Hi students, welcome to the lecture on notable blood vessels in the Saladin textbook. This is part of chapter 20. So we've already gone over anatomy and physiology of the heart. I've introduced some of the concepts related to the anatomy of the vessels, for example, differences between veins and arteries and capillaries, and now I'm going to go ahead and introduce some of the named blood vessels, both arteries and veins. Some of these you already know, of course, having studied the heart. Superior and inferior vena cava, for example, the aorta, and then we also took a look at pulmonary veins and pulmonary arteries. So this is basically just expanding on our knowledge of blood vessels and looking at some of those notable vessels throughout the body. All right, so first I'm going to be talking about major systemic arteries, and then I'll move into veins. But keep in mind, the grand scheme of things here, we have our heart, which of course is the pump for the cardiovascular system, going to be sending oxygenated blood out to the systemic circuit via arteries. The arteries fall into various size classes. We have conducting arteries, which are also known as large arteries. Then we have distributing or medium arteries. And then the smallest are called arterioles. And then all of those arteries eventually are going to move blood into capillary beds. So capillaries, these are porous vessels that allow for nutrient and waste exchange within all of the body's tissues, and then deoxygenated blood that also has metabolic wastes are basically that blood is going to be sent back through venules and veins. So we have the veins basically returning blood to the heart, and eventually that blood is going to be pumped through the pulmonary circuit to undergo gas exchange. But with the veins, we have the venules, which are the smallest veins collecting the blood from the capillary beds. Then we have the medium veins, and then we have the large veins. But remember that this is a cycle here. Ultimately, the heart is going to redistribute blood out to the body via arteries, and the pulmonary circuit is how we actually get rid of metabolic wastes like carbon dioxide. And then the systemic circuit is distributing that blood throughout the body. All right, so arteries, of course, supply oxygen and nutrients to all organs. A number of different blood-borne products that are sent out throughout the body as well. Glucose, other nutrients, hormones, which serve as chemical messengers. So keep in mind that it is larger than just gas exchange. There are nutrients that are being circulated throughout the body, as well as chemical messengers, white blood cells, etc. But cardiovascular system, kind of keeping it more anatomical at this point rather than physiological and just looking at the named veins and arteries. All right, so let's look at the aorta and its major branches. So the aorta, of course, we learned about the aorta when we were going over structure and function of the heart and blood flow through the heart, and we learned that freshly oxygenated blood is going to exit the left ventricle via the aortic valve, and it's going to be distributed to the systemic circuit out through the aorta. So now we're basically just expanding on that knowledge and looking at some of the major branches of the aorta, and ultimately all of these arteries that I'm going to be talking to you about can be traced directly back to the aorta. They're all branching off of the aorta at some point. All right, so the ascending aorta, ascending basically means rising. So the ascending aorta has a couple of branches, the right and left coronary arteries. That's part of the coronary circulation itself. So remember, coronary circulation is the circulatory route to supply the cardiac muscle itself with freshly oxygenated blood. So the ascending aorta, you can't really see them very well here. There's the right coronary artery right here that is actually a branch off of the ascending aorta. And then the aortic arch and descending aorta, again, these are basically just the main branches off of the aorta. So the aortic arch is this part here. So we have the brachiocephalic trunk, which in turn branches into the right subclavian artery and the right common carotid artery. So those are both off of the brachiocephalic trunk. Then we have the left common carotid artery that appears as it's coming straight up off of the ascending aorta, and then the left subclavian artery. All right, so those are the branches off of the aortic arch. The brachiocephalic trunk, as I mentioned, has the right subclavian artery that supplies the right shoulder and upper limb. The right common carotid supplies the right side of the head, whereas the left common carotid supplies the left side of the head, and the left subclavian supplies the shoulder and upper limb of the left side. So the descending aorta is the part of the aorta that is essentially plunging down here. So essentially it's going behind the heart here, and we see it pick up here through the aortic hiatus of the diaphragm. So this is the diaphragm muscle that's basically right at the apex of the heart here. And that, of course, is the primary muscle of respiration. Anything above that is going to be part of the thoracic cavity, and anything below that until you get to the pelvic cavity is going to be part of the abdominal cavity. So the hiatus, which basically means a break, the aortic hiatus is specifically a space within the diaphragm through which the descending aorta comes through. So the descending aorta basically has differing names depending on where you are in the body. If you're in the thoracic cavity above the diaphragm, so if you're basically from here to here, it's called the thoracic aorta. The abdominal aorta is the part of the aorta that is below the diaphragm in the abdominal cavity, but it's still part of that same vessel. It's kind of like a street name that changes depending on exactly where you are in the city, which can be really annoying. Okay, so that's the aorta and its major branches. Let's look at some of the arteries of the head and neck. We have the common carotids, which I mentioned on the previous slide, being branches of the aorta. The common carotids, both left and right, divide into internal and external carotid arteries. The external carotids supply most of the external head structures except for the orbit, so except for basically the structure within the cranium that holds our eyes. The external carotids give rise to the facial and maxillary arteries, among others, and then the internal carotids supply the orbits and about 80% of the cerebrum. So most of our blood supply to the brain is coming from the internal carotid arteries. Now, if you're watching this for my A&P2 class, I have tried to underline all of the structures that are on your learning objectives for the lab practical. That doesn't mean that each vessel that's on your list of learning objectives is underlined every single time that it's listed in a diagram. It's just the first time that it's listed in a diagram, I have underlined it. So keep that in mind, that there is an agreement there between your learning objectives and the underlined arteries and veins that you're seeing in this lecture. Okay, so we have paired vertebral arteries, which are branches from the subclavian arteries that combine to form the basilar artery on the pons. Remember that the pons is part of the brainstem. And then the cerebral arterial circle, otherwise known as the circle of Willis, is the arterial anastomosis on the base of the brain that receives blood from the basilar and internal carotid arteries, and it serves the cerebrum. The cerebral arterial circle or circle of Willis surrounds the pituitary gland and the optic chiasm, and we've seen these structures in our studies before. Pituitary gland, of course, part of the endocrine system, but that actually sits within a little depression of the sphenoid bone called the sella turcica, right below the cerebrum. And then the optic chiasm is where the optic nerves cross over, which the optic chiasm is essentially very close to the pituitary gland. So this includes anterior and posterior cerebral and communicating arteries. And let's take a look at that in a little bit more detail. So here's the circle of Willis. Essentially, you have your vertebral arteries here. So we have two vertebral arteries. They're going to form the basilar artery right at the pons. And then we have the posterior communicating artery. We have this is actually the internal carotid artery right here, the middle cerebral artery, and then the anterior communicating artery. So it basically forms this nice little circle surrounding the pituitary glands, adjacent to the optic chiasm that you see here, which has been cut. And then if we were to look at a lateral view, here again the anterior cerebral artery, posterior cerebral artery. All right, so let's look at some arteries of the thorax. Remember, the thorax is essentially the chest. So the organs contained within the thoracic cavity are going to be protected largely by the rib cage. It's going to be your heart and your lungs. So the thoracic aorta supplies the viscera, as I just mentioned, heart and lungs, glands, for example, and then the body wall. The bronchial, esophageal, and mediastinal branches, and then the posterior intercostal and phrenic arteries. So bronchial, if you know your terminology and basic anatomy, you probably know where these branches are ending up. Let's see. Phrenic, that's going to be your supplying the diaphragm. That's one that we probably haven't covered yet. Intercostal, that should be familiar to you from our study of the skeleton. And you can also just take a look at these posterior intercostal arteries, for example. Those are going to be between the ribs. All right, and then the internal thoracic, anterior intercostal, and pericardiophrenac are going to arise from the subclavian arteries. And again, take note of the vessels that are listed in your learning objectives, because those are the ones that you may see on the lab practical. Okay, arteries of the upper limb. We have our subclavian that passes between the clavicle and the first rib. So here's the subclavian. Remember, that's a branch of the aorta. And once it gets towards the area above the armpit, it is known as the axillary artery. Once it gets into the arm itself, it's known as the brachial artery. So the vessel changes names as it passes to different regions. Eventually it becomes the radial and the ulnar arteries. But again, this is just the same vessel that is called something different depending on the region that you're in. The brachial artery is used for blood pressure, and the radial artery is used for pulse. Probably tested this on yourself before, with the radial artery being used for pulse. Brachial can be used for measuring blood pressure. All right, so let's look at arteries of the abdominal and pelvic regions. The aorta is going to pass through that aortic hiatus in the diaphragm muscle. Remember that the diaphragm is that primary muscle of breathing. The descending aorta travels through the thorax, but once it basically pierces that diaphragm, then it's known as the abdominal aorta. So the descending aorta ends at approximately lumbar vertebra 4, where it branches into the right and left common iliac arteries. And do note that the abdominal aorta is retroperitoneal. Retroperitoneal, that should be familiar to you from studies of A&P1 and looking at body cavities and membranes, but essentially it is behind the peritoneum, which is that large membrane within the abdominal cavity. So it's essentially going to be right up against the body wall. So here we have our abdominal aorta. So this would be the aortic hiatus within the diaphragm. Descending aorta is now referred to as the abdominal aorta. This would be the celiac trunk here. We have a branch that is known as the superior mesenteric artery that supplies the mesentery. We have renal arteries that supply the kidneys. Gonadal arteries supply the gonads, so ovaries and testes. Inferior mesenteric artery, again supplying the mesentery, which I'll talk about momentarily. And then the common iliac artery and the internal iliac artery. So the celiac trunk supplies the upper abdominal viscera, whereas the common iliac arteries both divide into external and internal iliac arteries. The external iliac mainly supplies the lower limbs, whereas the internal supplies the pelvic wall and viscera. So branches of the celiac trunk supply the upper abdominal viscera, including the stomach, spleen, liver, and pancreas. And then the superior and inferior mesenteric arteries supply the intestines. And essentially what you're seeing here is this very extensive branching network of arteries. The intestines are actually surrounded and kind of held in place by the structure known as the mesentery, which has actually been recognized as its own organ system. Not really organ system, but the mesentery is an organ in and of itself. All right, let's look at arteries of the lower limb. Basically, branches of arteries to the lower limbs are going to arise from the external iliac branch of the common iliac artery. So here we have the external iliac artery here, and all of these branches of arteries are going to be supplying structures within the thigh and within the leg. Okay, with arterial pressure points, basically this just refers to areas where major arteries are close enough to the surface of the skin to allow for palpation of pulse, and also serve as pressure points to reduce arterial bleeding. One of these locations is known as the femoral triangle, which is superiorly bound by the inguinal ligament here. This is the structure in white. So the inguinal ligament superiorly, the sartorius muscle laterally, which is the longest muscle in the human body, and then the adductor longus muscle medially. So this is a really important area for arterial blood supply to the lower limbs, venous drainage, as well as nerve supply. I would like to talk a little bit about hypertension, which is just high blood pressure. It's often referred to as the silent killer. Hypertension is the most common cardiovascular disease that affects about 30% of Americans over age 50. It's called the silent killer because signs and symptoms often are not apparent, and the causes of hypertension can essentially just build up over the years until they actually cause some major damage. Major cause of heart failure, stroke, and kidney failure. It damages the heart by increasing the afterload. Remember that afterload would be the amount of blood that's left within the ventricles after systole. So after the ventricles have pumped blood out into the pulmonary and systemic circuits, it's the amount of blood that remains. So essentially, if we have an increased afterload, we're looking at a heart that is not very efficient. The myocardium ends up being enlarged until it's overstretched and inefficient. And it's kind of this positive feedback loop where you have the renal arterioles that thicken in response to the stress. And a drop in renal blood pressure leads to salt retention and worsens the overall hypertension. There's kind of two categories of hypertension. There's primary hypertension caused by obesity, sedentary behavior, diet, and nicotine. 90% of cases are going to be primary hypertension. And then secondary hypertension, it's called secondary because it's secondary to other disease. So kidney disease, atherosclerosis, hyperthyroidism, and Cushing syndrome make up about 10% of cases of hypertension. Let's look at the major systemic veins. Remember, once we have blood that has been distributed throughout the body via arteries, we're going to undergo gas and nutrient exchange within capillary beds, and then the smallest veins are going to be collecting that blood from those capillary beds, and eventually the blood is going to make its way into the heart via the inferior and superior vena cavae. So with major systemic veins, the deep veins typically run parallel to arteries, while the superficial veins are going to be a little bit more sporadic and less predictable. They are going to have many anastomoses. Veins of the head and neck, we have large, thin-walled dural sinuses that form between layers of dura mater. Remember that dura mater is the connective tissue, protective, fibrous, tough connective tissue that surrounds the brain itself and attaches it to the cranial bones. They are going to drain blood from the brain into the internal jugular vein. So we have the sigmoid sinus here, has this slight curve or S shape to it. The transverse sinus, the straight sinus, and then the superior sagittal sinus. So basically this is going to be serving all parts of the brain. We have our internal jugular vein that receives most of the blood from the brain, and then branches of the external jugular vein are going to drain the external structures of the head. The upper limb is going to be drained by the subclavian vein. So here we have our superficial temporal vein associated with the temporal region of the head. Vertebral vein is going to pass by the transverse processes of the vertebrae, and then the internal jugular vein going to be located right here, deep to the thyroid gland. Upper limb veins, we have superficial and deep veins that drain the upper limb, lead to axillary and subclavian veins that parallel arteries with the same names. And again, superficial veins, those are just veins that are closer to the skin. So they're going to be generally larger, more visible, and they're going to carry more blood. The median cubital vein is the most common site for blood draws. You can probably see this quite easily on yourself here. So median cubital vein is going to be a site for drawing blood from because it's fairly large and close to the surface of the skin and also low pressure compared to arteries. Veins of the abdominal and pelvic regions. We have our inferior vena cava. That, of course, is the largest vessel in the body. It's going to be pretty similar in size to the aorta, but it's actually a little bit larger. Similar to what we saw with the thoracic and abdominal aorta passing through the diaphragm, we see that with the inferior vena cava as well. So it forms at the level of L5, lumbar vertebra 5, to drain many of the veins that collect blood from the abdominal viscera. So basically right here is going to be where you have the formation of the inferior vena cava coming off of the iliac veins, which this should look similar to our iliac arteries, of course. They essentially are very similar in structure. The hepatic portal system. Hepatic portal system is a really interesting structure because it drains the nutrient-rich blood from the viscera, including the stomach, the spleen, and the intestines, and it takes that blood directly to the liver. And that helps to not only maintain blood sugar levels, because basically this super nutrient-rich blood that is filtered out from the intestines after we consume a meal, all of those nutrients, as well as potential bacteria or other toxins, are going to go straight to the liver. So the liver is going to kind of act as the kind of almost a buffer, I guess, for harmful substances that could have been in that food we consumed, but it also helps to maintain blood sugar levels at a steadier rate. So basically what we're seeing here, we see hepatic veins, hepatic having to do with the liver. Inferior vena cava, of course, is this whole structure. Suprarenal veins. Remember what these glands are called? Those are the adrenal glands, so suprarenal, basically on top of the kidneys. We have our renal veins, of course, just like we saw with our arteries. And then we have our gonadal veins, which are draining blood from ovaries and testes. For the lower limb, we have the dorsal venous arch that collects blood from the toes and more proximal part of the foot. Its network of veins is usually visible on the dorsum of the foot. It gives rise to the saphenous veins. We have the small and great saphenous veins. So the dorsal venous arch here, again, you're going to be able to generally see this because it's fairly superficial, close to the skin. It's going to give rise to the small saphenous vein as well as the great saphenous vein. The small saphenous arises from the lateral side of the arch, passes up to the popliteal vein. Remember, back of the knee is essentially popliteal. And then the great saphenous, which is the longest vein in the body, passes up the medial side and travels all the way up to the inguinal region before emptying into the femoral vein. The great saphenous vein is actually sometimes used for coronary bypass procedures because you can generally actually take a section of that vein and use it elsewhere if there's a coronary issue that needs to be corrected. Okay, finally, just a note about portal hypertension and ascites. This is a case of liver disease that can be caused by a parasite, which are basically blood flukes, and that's known as schistosomiasis. But portal hypertension is just an obstruction of the hepatic circulation. It can cause blood pressure to back up in the hepatic portal system. And the reason it backs up in the case of schistosomiasis is actually the smallest veins within the liver vanules, become clogged with eggs of those parasitic worms. And that causes a lot of inflammation. It can cause fibrosis within the liver. It can cause the spleen to enlarge. So high pressure within the vessels of the abdominal viscera can then leak serous fluid, and as a result you can get this condition known as ascites, which is distension of the abdomen. So this is what we're seeing here in this image. This is a pretty prevalent disease, especially in tropical regions. Let's see. Yeah, so that's pretty much all I have to say about portal hypertension. Let me know if you have any questions, and study your blood vessels that are on your learning objectives, and I'll see you next week.